And for the translation team across the world, thank you. And let's study together cyberspace. Gradually, we have a little idols that I created for our cyberspace study. And today we are going to welcome Dr. Lin from Taichung City Hospital. Yingchao, Dr. Yingchao. He is a neurosurgeon because we always wanted to invite him even at the beginning of this year, but he's so busy. So finally, he's here today. These are the editors of our team. And she is the editor and also not only the graphic but also the text editor. It touches my heart so much. And Hong Yuting, Sister Hong Yuting, this is the posters as made by a editor, general editor, and Hong Yuting. She is the professional editor, graphic editors. They make this very beautiful posters for you. He is the very powerful surgeon. This is a training, fitness training. Here, the top weight, the Dr. Lin. This is Dr. Lin, Surgeon Lin. He started too late. He could start it earlier. Every time I am going to clipping away a nail, or he needs strength in his he always uses strength power from his palm and finger, but actually he needs to use the strength from his back. And after the weightlifting training, he could use the correct muscle to use use the power to help his patient during surgery. How are you? Did you gain weight? You look very energetic. For more than 20 years, Dr. Lin has accompanied my mom and always encouraged her. She encountered very unbearable condition in the life, but she still keep her spirit high. The patients say, "I love you." After we listening to her, his sharing, we were all fall in love with Dr. Lin. Look at this lady. She walked like a supermodel with her dress. She's so happy. And this is just like normal girl. And when you were very sick with a scoliosis, severe scoliosis, it's very hard to stand up. To help herself to stand up right, she practiced yoga and dance. And when her bent degree is about 80 degrees, it's very hard to breathe, and the dilate of her heart is very difficult. So Dr. Lin gave her a surgery, conduct a surgery on her spine and correct her spine bending degree from 80 to 30 degree. After 2 months of surgery on her spine, she grew about 6 centimeters. and normally after surgery, patients grow 2 to 3 centimeters, and this lady she grows 6 centimeters as a very as a traumatic change in her appearance. If you are touched, please give a big hand to Dr. Lin as very powerful and very professional in his in the neurosurgeon and the neurology about the aneurysm. Cerebral aneurysm is a very surgery is very difficult. You have avoid to um avoid the injury in the good parts, and a lot of time I don't feel anything in my left leg. When I walk I go straight, and in his brain there's a cancer keep eating up the normal cells in his brain. um the Dr. Lin gave him a surgery. I've agree normally gradually gaining back. And have you heard that? Heard that the surgery took 10 hours. That's why he needs fitness training, weightlifting training. We appreciate that Dr. Jen guided this doctor to the Drama Sutra musical adaptation. And Dr. Jen also shared how he's take all the doctor to the musical adaptation. I feel very touched. Even when I was sleeping, I still think about the musical adaptation. It touches my heart. The performance was very well overwhelming. I love to be with you because you are energetic, because you have positive energy. We appreciate that Dr. Lin is here, Kaohsiung, from Taichung. Before you listen to our sharing, you probably don't know him, but after hearing our sharing, you will fall in love with him. And when you search online to look for the video of regarding to Dr. Lin, you will find many videos about him. And Sister Mingyue introduced you to me. Mingyue is a volunteer at City Hospital in Taichung, and she introduced Dr. Lin to me. And also, I already know Dr. Jen, Superintendent Dr. Jen. I didn't know any other doctor. And Mingyue's sister introduced Dr. Lin to me. I'm very grateful that he's such a great surgeon. We learned so much from him. Dr. Lin has make a little change in his PowerPoint presentation. And let's welcome Dr. Lin. There's love from doctor and nurses. And please start. Um,
对对对，那时候有，
you, and
我一直要找那张
I
相，
make
可是
little
没有找到。
changes because I
那
found
一
mistakes.
直很想要来
But
这里，
now,
终于有一天成型。哦，
you can use the old version of PowerPoint
1年前
presentation.
听到可以来，然后当然有一些因缘。那刚刚看的那些新闻，都是在这一年发生的事情，
Please go
所
ahead.
以1年来发生了不少。那
Thanks,
今天来
Teacher
最主要
Meiyun,
是跟
and
大家
thank
分享
you
我们做
everyone.
神经外科的
And
一
we
些
sent her.
心情。
I remember her. I
有些
sent
事情
her
你要
to the
努力
parking
去
lot.
做，要不
I was
管怎
looking
样都
for
要
the
去克服。
pictures
有些事
that
情
I
该
took with
放手的时候还是要
Sister,
放手。
Teacher
你今天
Mei
看到
Yun.
一个
Uh,
外伤，
I always
哦，
want to
你
come,
怎么
but
治疗它
finally
都是
today
不
I
会清醒。
made
有
it
些时候我们会让他
here.
离开，因为离开也许是他最
We
好的选择。
watched the
这
video
就是我们的哀愁。但
in
是
the
也看到有些
past
外伤的病人，我们治
past
疗好
year.
他以后， 他
I
中
still
间
remember the
甚至
condition.
考上大学。
Today I
那这
want
样
to
的一个
share.
病人，就让我们觉得很美丽。
I want to share
不过往往人的一
how
个
to
哀愁
become a
就在以前就有。
neurosurgeon.
那在哀
You
愁之后才会有
sometimes
美
if
丽。
you it's
我们有
time
下面
to
的小组长
release to
天
let
来
go.
说，
You have to learn
他
how
是
to let
一
go.
个64卦里面一个
Sometimes
天卦。
the patients
64卦
those
有四难
conscious
卦，那这个是
you just have to
这个
let the
天卦代
patient
表是
go.
神
Maybe
难，
that's
就
the
是很
best
难。但是往往
arrangement for
来
the
是
patient to
和解，
just
这
let
是神
go.
教我们。所
Um,
以其实我
and
们都是
sometimes
绕着这个。
when you
那
see
他在
a
卦辞里
patient
面一
who's
开始
in
是美
coma
丽，就是你
wake
刚
up
开始做的时候，
and
也
go
许
to
是因为
school
往
and
难的地
have
方
a
走，
great life,
很
you
困难的事情
feel
你做了，
very
你会
happy
进
for
步，你
the
就会得到一
patient.
些名誉。接下来你会来
Um,
访，就是你会遇到什
the
么事，最后你会
the
来解，
from
就
the
是你
book
会
of
觉得
change
你做的很开心，这时候就
cosmological
是机会，
text
就是
there
好事，
is
就听见来。所以
10
呢，在 陈述上有一首更
hexagram.
美丽的哀
It
愁，
means
它里
that
面讲
just
说你
to
的美丽都像
when it's
在叹息
hard
中
to
渐
go
渐老
on,
去。
you
所以
still
美丽是暂
continue
时
to
的。
go
我们常常
on.
看
And
一朵
when
花
it's
朵，它开
hard
放了不
to
起几天到几个礼
to
拜就
do,
终结。
you
可
still
是真
overcome
正开心的是，培
obstacle
养这
to
朵花起
continue
来以后，
doing.
它在
And you would
这个培养的过程
you
中，它
would
得到的
encounter
开心，远比
difficulties,
他看这朵花
but
开
you
的时
will
候，人
gain
家看
and
到的
learn
开
so
心。所
much,
以
and
有些时
you
候我们
will
看到
be
一件
able
事
to
情，
expect
你
the
看到它很美，
auspicious
可是想到背
condition
后
come
真正
in
开
your
心的，像
life.
上人讲说，我们要
And
听过千百遍，不
and
如
there
做过
is
一
a
遍。
very
所以以
famous
前的时候，
song
我
in
们希望自己在走，
1989,
所以这个就是我们觉得
1999,
美丽的哀愁
1980,
给我的感想。
1988 in Taiwan.
那今天的主题就
All
在
the
燃烧意
beauty
识。
in
所以第一
your
个
imagination will
要跟大家讲，我们怎
gradually
么样在
grow
困难
in
中，在压力下，
aspiration,
怎么样去过这样
and
神经外科的生活。
beauty
神经外
is
科大家知道
changing.
很
It
难，
disappears
难
in
在
the
哪里？
blink of an
人
eye.
在生活非常急
But
促，
the
人
mix
在
of
生命强就在你手
sourness,
中，难在
sweetness,
有些
and
时候
bitterness, and
你的生命就在你手上流逝。我们开一台刀，你再强的都会
acidity
活下来，可
of
是
the
走到那
course
个
is
年纪，
going to
可能
be
只
the
剩下半个人的生命就
sweetest
失去生命。
memory in
神
the
经外科有
heart.
几个刀是很难，第一个就是血管瘤，因为
And
它会在
today,
你
I will
胃里，
remark as
大
go
家有没
on
有
when
试过
it's hard to
血管，那个
continue
水一直喷出来，你要去压，
during
你如果
when you
没有把水
encounter
止掉，它
difficulties.
是没办法修。
And there's
血管瘤
is
就是我们
surgeon
人生里面的
is
血管，
very
那你必须要去
difficult
止住这个血，
to be
我们没办
surgeon.
法让血管被堵，
And it's
所以必
very
须
hard to
一堆水进来，一堆血
to
水进来，你要
face
找到那
when
个
a
血管的阻
patient's
地 地
life
方。所以
is fading
曾
away
经有病人在我
during
面前， 你
surgery.
要去夹他的时候，他爆，
The most
那时候的心
difficult one
其实是没
to
办法想，你只能
to
想，
face
赶快把它夹
is
起来，
the
把上下几个血管再止
aerial
住。如果能够夹就夹，不能夹
aneurysm.
这病人
The
就有可能
cerebral
说被抓。
aneurysm
哦，
is
所
the
以
most difficult
这个是一个
condition.
困难。第二个困难
When
就
there's
是很深的肿瘤。
rupture
假如我
in
今
the
天要去修我对
aneurysm,
面的时钟，
it's like
我
the
用一个很长的长
leakage
杆
of
去
the
拨那个时钟，大
the
家就会
water
明白。
pipe in your
哦，它
home
不是在我
is
面前，
going to
它是
flood
在
your
很深的地
home.
方。所以
And
脑袋
so
它
it's
就是这么
food
大一个空间，
in the
可
school
是我
is
们看
full
到的
of
位置大
blood.
概就是1公分。
You
如
don't
果你那个
see
距离超
clearly
过了5公分，甚至到9公
and
分的
you
时候，
have
10
to
公
clip
分，就是
up
刚好在头型的时
to
候，
where
你
the
是拿一个
leakage
长杆
is.
去修前面的时钟，
It's so difficult. You cannot see very clear. When the tumor is very deep in the skull, it's very hard to reach it. As the skull is not a big place, and you have to avoid her to create injury and the healthy area of the brain. It's very, very difficult. And you don't want to create injury in the healthy part of your brain. And you have to reach into the deep place where the tumor is. When the patients are old, you patients don't want to accept surgery because it's so hard. And attending physician has told me that clipping the first aneurysm as you are not eligible to be called as a neurosurgeon until a rupture of an aneurysm bursts in front of you and you use a skillful procedure to help your patient successfully, you are entitled to be called as a neurosurgeon. Doctors are not flinty. Oftentimes we feel unendurable and sad. We are only Dr. rather than God. And when the rupture in the aneurysm, and it's like the leakage of the water pipe in your home, it's very hard to stop the bleeding. And the patient, you only have less than 1 minute to help the patient. The patient will become unconscious within one minute. And a lot of time it happens in the young patients, and they lose conscious within a minute. After the surgery, you still the condition is still very risky. How to take good care of the patient is still very stressful. After the surgery, a lot of patients still have disability. A 29 years old patient, she came to Taichung to visit her friend, and she feels severe headache, and she came to emergency room, and she has temporary unconsciousness, and she suffers from comatose, and we have to examine her through CTA. We have to use a titanium to clip her up, to clip the aneurysm. And you can see from this picture, this picture was that looks terrible. We have to clip up her aneurysm, where the rupture is. And the rupture is in a very deep place in the skull. You have to locate the correct place where the rupture is, and you can feel that after we clipping off the aneurysm, and she finally wake up, and she can move her limbs freely. And if you clip, after you clip, her aneurysm,
好在这个病
and
人他
there's a
讲完以后我也去
hemorrhage,
看，病人看完就
and
醒。
you would know
醒了
that
我们就
it
照顾他，想说
um
他就度过了这个人生
this
最难
patient
关。
would
大
lose
概2个礼拜以后，他就
conscious
要准备
lose
开刀。
consciousness
有一天
and
早
would
上开加护病房就跟我讲他
probably
要
lose
过世，
life.
那我们就想到最
And
恐怖的事情，
when I was watching,
大概
when I
1个
was a
月的时候会出
student,
现。那有
and
时候最晚
I
就是14天
saw
最
my
严重，
teacher,
病人有时候会因为这样造成
his
后
hand
续
is
不适。
shaking.
所以有
I
些时
didn't
候
know
我
what
们来得
happened
及，
to
会用
my
一个
teacher,
会请
and
血管外
now
科或者是请
sometimes
通联科去帮他
my
排血。
hand was
可以看到图
shaking
中这个
too
血管
because
会
I
因为
was so
痉挛
afraid
以后它会受
I
损，
might create
所以他
a
就跟我
further
们拿一个
injury
袋子把血管绑住，
in
那往往
in
这
the
1到
brain
2
of
周以后
my
它才
patient.
慢慢会松开。
And
所以
what in the
这时候
one
就
of the
很危险，
case in the
我们
preparation
心
of
里面很担心
translating
怎么办，
him out
那
from the ward,
只能
the
希望
most
他可以
avoided
坚持过
condition
来，因为
happened that
剩
is
下
a
的事情他需要
cerebral
自己这个血管
vascular
通了以后，
spasm.
然后慢慢
The
再醒来。
derivative complication
终于
is
醒来了，
unexpected.
可是醒
The
来以后
patient might not wake up
眼睛会
forever
呆呆的看。
or
我
might
想
recover after a few
这时
days.
候我那天
Spasm
看
might
一
cause
篇文
restriction
章，
in
就是
the
我最近
vessels
在研究
to
植物人
block
的一个预言。
the
他
blood
跟我们讲植
flow.
物人其实
It
就是
might
比
cause
死还要死啊，
is
生不如死啊。
ischemic
这是预言文章，我们要
stroke.
对
The
对，这是
patient
他讲的，
gradually
比死还
gain
要更死。所以其实对我
consciousness
们来讲，
after a
如
week,
果他一个人不
but
能
could
清
not
醒的时候，
speak.
我们要让他29岁活到
Consciousness
50岁、
was not
60岁，
clear.
这是何等的难事。
Finally,
这
he
种
wake
这
up,
种思考，
but
就是我
he
们
couldn't
长者
speak,
那每天就要想这
and
个事
he
情，
didn't
每
gain
天
back
放
his
下班前去看
consciousness.
他，上班前看他。哦，那中间想
We
到
were
说这个
we were
那就不知
we
道
were
说他什么时候
studying
要醒
a
来，可是时间一直在走，刚好遇到
vegetation
吉祥月，
state.
那天吉祥
It's
月在
more than
在
death
祝福吉祥的时候，
because it's
我在想
worse than
多
death.
希望这个病患真的吉
If
祥，
a
慢慢
person,
能够
a
醒来。
patient, 29 years
这
old,
个可以放出来。
and she
所
is
以后来
in a
病人他
vegetation
醒来，
state.
我们来看
It's
这一段，
really,
这
really
个也是我们
sad, not only for the patient but also
我
for
们
the
就在
whole
问他，他说
family.
他不认识我，因为他没看过我。
I don't
他
know
醒来的时候，他已经走
when
回
she
台北
will
回
wake
家，
up,
也就是他
and
虽然眼
it's
睛会睁开会活
it's
动，
happened to
但
be
他什么都没看
in the July. Chiji has a prayer service, so I attend the prayer service. I send my utmost pious blessings to her.
没有
And
那
let's
个声音
take
可
a
以
look
吗？
at the video. Come, sit down.
好，
Do you know
关系
me?
他后来
She
醒
said
了，
she
反
doesn't
正因为
know
时间
me.
很赶，也
She
许也
she
去看
didn't
诊。
she
他那
hasn't
时候醒来的
seen
时候，
me
他妈妈来
before.
看他，他是 眼
She
他的旁
was
边放了一个吉
she
祥
was
物，所以
unconscious
他觉
when
得
she
我
was
们竟然能
hospitalized.
够这么的想着他。那他回去了
And
以后，
now,
他开始他就觉得这个1分多钟，
and that's okay.
来坐，
It's okay
哦，解决
without
完
the
了，
voice
所以
from the
他真的
video.
不知道。所以那时候开刀前，
And finally, she wakes up.
后来就
I'll speak for her. After she wakes up, her mom
生活那些
said that she was very touched when she have her mom went to the ward to see her, and her mom was very touched that she saw a package of rice that I received from the prayer service from Chiji. I put the pack of rice by the pillow of this Zhang Wenxin, my patient. How when I clip in the aneurysm, I worry so much because I cannot predict what would happen after the clipping. The rupture of the aneurysm, the death rate is 20 to 30%. Finally, she regained consciousness. And when she was transiting out from ICU, there's complication. She fell into unconscious again. Dr. Lin prayed for her. After a week of treatment, she can open her eyes, but she couldn't speak. And she can walk. And now, and he went to the prayer service of Chiji, and Dr. Lim gave the pack of the rice that was all the blessings placed by the pillow of my daughter. I was very touched. I love this book. As neurosurgeon, it's risky, messy, and often frustrating. When the air hits your brain, it's the book I love. Neurosurgeon is risky, messy, and often very frustrating.
Okay, I'm just an ordinary people, and to me, a lot of damage and the disease, they are not able to repair through the medical treatments. Actually, we are doing tug of war with the God. We are trying to save the patient's life. If we did it and the patient can survive, like the brother Wang, and once he went back to the abbot, and the master asked him, "Why are you going to talk to people about Tzu Ji?" And after he retired, he adapted the different skill that was totally different from his professions, and that was poster printing. As you can see from this footage, that all of this poster was printed by him. At once, while he was at the Chinese hospitals and trying to paste the poster, and the sister walked behind him, see that he's walking ashtrays. So they asked him to go to see the doctor. And at that time, we performed the exam for him, and we find out there's a huge tumor in his brain. He's walking, he's leaning sidewalk. Actually, it happens a long time ago, especially when he was typing on the keyboard, and he always cannot hit the right key, so he kept changing the keyboard. He thought it was a broken keyboard, but end up it is his own problem that he couldn't hit the right key, so he keeps showing up the error typings. So I recall back in that time, I already had the symptom long time ago. And as you can see from this scan, you can see there's a huge tumor in his brain. It is almost impossible to perform the total resections. And through the CT scan, we diagnose this as an astrocytoma. In adults, they are the most common brain tumor, and most astrocytoma affect the patient over 40 years of age. And usually the older the patient, the more likely the astrocytoma becomes a malignant. And for him, that was diagnosis as a stage 4 astroblastoma. And normally its survival time is around 15 months. Like yesterday, one of the patients came to do the chemotherapy. He survived almost more than a year. And because of the area of the tumor, it's hard to perform the total resection of the tumors because of the location of it. So the common syndrome, you might suffer from a persistent headache. And some of them will feel weakness, and also they can suffer from the cognitive decline, the nausea, vomiting, or difficult in speaking, or the loss of weight. And usually when people realize they have the symptom, they come to me, it's already too late. And the assisted treatment can including the chemotherapy or the radiation therapies. And like this brothers, he's very optimistic, and he always say that he has been through many tests. He always can get a good score by his own hard working. But this test is out of his expectation. He cannot rely on himself. But every day he's still working very hard to do the rehabilitations. So during the Chinese New Year's, he keep practicing and also accept the chemotherapy and radiation therapies. And as you can see, his left hand and left feet, he can move pretty well. And he always has this confidence he can pass this test. But in the middle of the year that we find out there's a recurrence of the tumors, and the family think that we already give him 6 months longer of his life. So he decided to undergo the palliative cares. So during the repenting ceremony, he also attended the ceremonies, but he wasn't able to talk at that time. He was sitting on a wheelchair and he's watching this performance. And the family really appreciate that we can extend his life for a little longer. So he still failed this test after all. So same thing happens a couple years, last years. One of the CEO in the pharmacy store, he's a very rich person, but when this happens to him, he still couldn't get away from it. And another director also has the same astrocytoma. And last time when he can visit us, he also suffered from the difficulty in speaking, but he really want to talk, but he was suffering the difficulty in speaking to us. It is really hard for him, but after all, he couldn't get through it. And the next day morning, he passed away. So very peacefully, and he also at the palliative care at the end of his life. When this is encountered in your life, even it's hard to let go, you still have to let it go. As a 30 years of a surgical neurosurgeons, I will try to extend the patient's life, and I still cannot bear to see the patient's life passing in your hands. And every time when a patient come back to my clinic, I always feel so happy to see them because I extend his life for 1 extra month. And I keep asking them to cheer up, to keep on going. And I cannot believe such a happy person, and this will happen to him. Even this is unfair, and I still think that God is not fair to some of these people. So all my life, I try to figure out some of the disease. I try to find out how to cure them, but even that, even the chance is very little. But I still try my best to complete the mission what God gave me. And I would like to share another case that is hard to do it, but we have to still do it. You know? Every time I feel this patient come to me, he hand his life in my hands, and I will do the best I can do. And I always take it as a commitment. This is a mission I have to complete. And there's a 19 years old student. When he come to visit me, he had this dual expression. His eyes can well focus. It feels like his eyes is can focus at the same spot. And he complained that he has suffered from the dizziness and a headache more than a month. And he came to me, and he's a very young student. He has a very Is this operable? And actually, in 2 months and 2 weeks, he will be experience his spinal exams. Would that be possible for him to postpone the surgery and finish his school first? But actually, it's impossible to do it. And we find out the tumor was located in the pineal gland areas. It's just like because the tumor is right inside of the middle of the brain, it was hard to get into that because it's a vein. An important vein is blocking in the way. So once you damage that, it was like a fluid flowing to the brain. It will be like flooding in your brain. So when I was at school, the teacher always told me the tumor in the pineal gland is the most difficult surgeries. And even through the surgery, we doesn't know. We are not sure that is curable or not. And as you can see, when this happens, you can see the symptoms that his eyeball cannot stay focused on the objects due to the compression or invasion that making it impossible for the eyeball to look upwards and focus, and resulting in the so-called sunset eyes. And accounts for 14% of the primary brain tumors. This is the germ cell tumors. It is more common in Asia than in Europe and Americans. And the main sites of the occurrence are at the sella turcicalis or the pineal gland or the basal ganglia. But when they're located at the pineal gland is the most difficult parts. And among them, the trimelanoma is the most common and accounting for about 54%. So after the assessment was stemmed, we hopefully that we can perform the operation first before he returned to school. So as the entry points of the surgery, I try not to perform the traditional central incision, and I switched to the latest developed surgical techniques, which was found the hemilateral position and successfully avoided deep drainage veins. So a couple months after the surgery, we find out that the tumors almost disappears. Even he had to drop out from school, but he can work. He can walk further more. His life can go smoother and healthier. So as a surgeons, I can treating patient well, like paving their way with love. I can help them extend the length of their life and also expand the width of my life. And we can even become friends and even become a family of them. Other than that, after I joined Tzu Jing, I did a lot of things. I can be a volunteer. I can participate in the free clinics, and I can purify my mind and tolerate the humiliations. And the picture on the right side, you can see there's a clipping of the vessel. The vessel is very thin. And Master always say that being willing to do it and be happy to bear it. And lots of people ask me why I joined Tzu Chi. Before I joined Tzu Chi, I really don't understand Tzu Chi. But after I joined this, I feel that I'm happy to do Tzu Chi. I'm really happy to bear it too. So even behind this, lots of sorrows behind these things, but most of the time I enjoy what I'm doing. And my team are a great teams. I'm very happy to have them. And I hope that we can cultivate in life. We can do my best at work. So while you listen to these stories, you can realize that he is very stabilized. He's very calm. And maybe you have already seen this a lot. His stabilization can really comfort a patient's mind. And he's very tall and he talks very softly. Do you feel that? If you first see him, when he first, and he also shared that when he first come into Tzu Chi, he has no clue, had no idea about Tzu Chi. So how do you know Tzu Chi about? At that time when I joined Tzu Chi, and I was actually working at the other hospital. But the Tzu Chi hospital was building at that time. So the hospital invited me if I want to work at the Tzu Chi hospitals. So at the first and I meet the directors. And at that time, I had the very curly hair. And the director asked me, would you like to join Tzu Chi? And what happened to your hair? I said I had a hair burn because I have to work 24 hours a day at the hospital. So it's just easier for me to manage my hair. But the director said, because the Tzu Chi is a religious organization, so we need to keep our outfit neat. And here I learn about the Dharma's sutra of the Dharmas, and I learn from the preaching from the masters. And I wish I can stay in Tzu Chi as long as possible. I'm glad that I asked these questions. Actually, before he's not natural curly, he wants his hair to stay curly because it's easy to manage. Because even it's a mess, you cannot tell your hair is a mess. So every time when you see my hair, it's always a messy hairs. Every time after I wash my hair, I just go straight to work because I have no time to manage my hair. But today I keep my hair neat, so I just had a haircut. So at the same time, in your footage, you say the 10 hours of operations, the longest that you stand aside of the operation table, that is 16 hours. A lot of people are very surprised that I can stay by the operation table for 16 hours. I don't have to go to the restaurants. So after that 16 years, my arms and my legs are so sore and feel very stiff. And so if you don't exercise, if you don't attend the fitness training, there's no way I can achieve this. So through this, we can understand he's a professional surgeon and a less of a persistence for him. And he's really the superhero. He uses a professional knowledge to treat the patients and save the patients in their critical moments. Your beauty and sorrow are the fourth of the stories. I really appreciate your sharings. It tells us all about this karma and the cost, and a lot of people will be saved from you. But seize the moments and seize our life and accept whatever happens to us. And the director, Dr. Lin, you are super handsome, you're super cool, you're super tall, and super strong. And it tells all about what we feel about him. And we thank you for sharing the And it's continue even when it's hard to go on. So you need to play tug of war with God, and you really try your best to save the patients. So we can understand more about what the medical personnel, what they're hard working to save the patient in the last minutes, and how to fight with the God to earn more time for the patients. So the brand is very important. And the longer, the better. So we try to keep the patient survival the longer, the better. And our teacher also, our volunteer also accompany our presenter, because they will take the photograph for all of us with all these affinities that we can have you to be here to give us such a distinguished presentations. And usually the hospital will arrange who come over to the study group to share their presentation. And we really appreciate that. And this time, you can have him to share with us. Just like him said, you cultivate in life and do the best at work. We really appreciate your